So, firstly, that on 6:53 p.m., 108 emergency call center received a call about the event, and ambulance was dispatched immediately to Maoyong Rim playground from.
Ka sorkar Mikhalaya kalapan pau patba wa omshem ladon kanu ka jingpen slem ne jingkang ha sumar ya MP na Shillong Dr. Ricky H. Singkon Hamauyong Community Health Center. Uni unang yalam jong ka VPP ulaklat no adin po ulasak ta ha ka jingpang cardiac arrest. Umentri ka kot ka kia wailat Miki Shilla ulaong bahadin ka jingtokit ka balapan long da kibor ka tanat ka kot ka kia district lalap ba omshem ladon ka jingkang jing sumar ni jingpen slem ban penkriya sa ka jaka sumar ka pakhamhe. Katkum kajing ong jugu ka 108 emergency call center kalayo kajing pun ha kapon riu baji san polai minute jan mit bat kalapha mator ya ka ambulance sha ratsun futsal ground ha lau mali henry hadin katuk ani minute lapente balara lupa ya unong pang shamawyong CHC dakali shimet ha kapor kubanyo shipawa jan mit lawan ra ya u Dr. Ricky sha ka emergency room hadin ba ulak lempor ba yale kai futsal ha kapor ba ulapoi om shem lala banyo tho ya ka blood pressure don pulse bat ulabom tip briu shu kinong trei ka hospital kil ai oxygen marjor bala persang CPR rei shem ladon ka jingkala halor kini ka jinglong bas kam stom larai ban pingkri ano yu sha Dr. H Gordon Roberts Hospital ha ka ba ulapoi ha ka por ku mahnyau sau pho minute chan mit katkum ka kai pot ka hospital shem ladon dak jing im ha ba poi Menteri ulang bagi nong tray ke CHC ke lele ya barok ke kam kat kum ke bor bat ke jingla jong ke community health center kentup ke jingpet mardor ke jing ai oxygen ke CPR bat ke jingpen kenria ha ke por ke papiang ha ba kren pang ke jing tuna doktor ha ke jela usla u lapen pa bo bat la saungut ki doktor labu hamau yong CHC henrei tang uwe udon ha ke kam menta namar arngut ke lalej puli shu bat uwe pat lapen kenria shakli riat CHC u doktor ubasa utrei nadu khandai baji men step adu sau baji chan mit ha OPD bat udon ha call hadin kata u menteri ulong ru ba ka finance department jong ka Mikhalaya kala menjur bantung shispa san pungut ki doktor contraction u principal secretary katanat jong ka kot kia u sampat kumar ulong panamar ka CHC hamauyong kadon hajan ka sor silong ka jingwat patba kambun bha la perkhat ru ban penon kam katu ka ni benta ka jaka kum ka di addiction center ban penpet ya ka jingtuna doktor ha ka jalla Mikhalaya ki bor sarkar ki dang tre stom ban penbha ya ki jakasa jong ki doktor bat ki nurse na khami ilintiru ba ka Shillong Medical College and Hospital kan wanra shushu san phongut ki doktor thamai kat ba ka tura Medical College ru kan yarap ban pen khlan ya ka jingdon ki doktor ha ki number 1
At approximately 7:15 p.m., Honorable MP Dr. Ricky A.J. Sinkan was brought to the emergency room of Maoyong CIC by accompanying person following a reported collapse while playing football at a nearby ground. On arrival, the patient was unconscious and unresponsive. Initial assessment revealed blood pressure not recordable, pulse not palpable. The patient was immediately attended by the staff nurse on emergency duty, and the medical officer on call was intimated. Oxygen support was initiated promptly. Cardiopulmonary resuscitation, which is called CPR, was administered. Despite these resuscitation efforts, the patient did not respond. In view of the critical condition and non-response to initial resuscitation, the patient party was informed of the need for immediate referral to a higher facility. Referral and transport. At approximately 7:20 p.m., arrangements were made for transfer. The patient was shifted with oxygen support by the Maoyong CHC ambulance. The ambulance reached H. Robert Gordon Hospital at approximately 7:40 p.m., where the patient was handed over to the emergency team for further management. As per the medical report of Robert Hospital on arrival, the patient vitals were not recordable and pupils were also bilaterally fixed and dilated. So, out of this, the finding of the inquiry confirmed that emergency assessment and basic life support measures were initiated promptly upon the patient arrival at Maoyong CHC. The staff present acted within the scope and capacity of a community health center, including immediate examination, oxygen administration, initiation of CPR, and timely referral to a higher facility. There is no finding of refusal of care or delay in referral at Maoyong CIC. So, through this, the health department reiterates its deep condolence to the bereaved family and the people of Meghalaya. And also we realize that sudden medical emergencies such as sudden cardiac arrest are time critical even where outcomes depend on multiple factors including patient underlying condition and immediacy of advanced life-saving intervention. So this is the inquiry report which we have sent the DMHO of East Khasi Hills to find the sequence of event in CHC Maui.